Amelia is a medical condition characterized by the total or partial absence of one or even multiple limbs. Total amelia or tetraamelia is an exceptionally rare occurrence and is estimated to account for approximately 2% of all ectramelias. Mortality is very high due to the frequent presence of anomalies in other organs and systems. Amelia of the upper limbs, or brachial amelia, is the most common form. In unilateral forms, scoliosis is consistently present due to the weight difference in the scapulohumeral girdle. The defect usually stops at the shoulder joint without involving the scapula. Small bony remnants may be visible on X-rays, especially in adulthood due to delayed ossification. Amelia of the lower limbs, or crural amelia, is rarer. When it is total, it always affects the pelvic girdle with absence of the ipsilateral hemipelvis. The complete absence of the pelvis and lower limbs, known as ectosomia, is incompatible with life. The underlying cause of the condition known as amelia is generally attributed to an internal endogenous factor, although reports of familial cases are extremely rare. However, possible peristatic factors such as maternal measles cannot be entirely ruled out. This condition can occur occasionally in association with vater, appearing alongside esophageal atresia or imperforate anus and vertebral anomalies. The pathogenic agent is believed to act during the 3rd week of intrauterine life.
Dear colleagues, I have chosen Professor Canepa's lecture to introduce the case I will present to you today. This is a case of a fetus at 12 weeks and 5 days that came to our medical attention due to the finding of complete amelia of the right lower limb. As you can see in these clinical clips, the right lower limb is entirely and completely absent, presenting a case of pure unilateral pleural amelia, with a total absence of bone segments and muscle buds situated below the acetabulum. As for the contralateral limb, the left one, all bone segments are regularly present and properly ossified, with biometric measurements corresponding to the gestational age. However, this limb shows signs of hypokinesia, as no spontaneous flexion-extension movements were observed during the entire examination. Furthermore, there is some doubt regarding the axis of the foot, which will need to be reassessed at a more advanced gestational age to rule out the presence of clubfoot. Moving cranially, you can observe that in this fetus there is no clear visualization of the ossification of the spine at the sacral level. Throughout the entire examination, which lasted over 30 minutes, a clear filling of the bladder was never observed. It is also highlighted that there is a single umbilical artery, which, as we recall, is associated in 20 to 30% of cases with other anomalies, and among these, the most frequent are those affecting the genitourinary system and the skeletal system. Moving on to the analysis of the renal lobes, at this time the 2 kidneys are not clearly visualized. However, since this examination was performed at 13 weeks, this finding must be confirmed at a more advanced gestational age. One detail that should not be misleading is the normal amount of amniotic fluid, since at this stage the volume of fluid is not a direct indicator of renal function, but it will become so at a more advanced stage, around 14 to 16 weeks, when fetal urine production directly contributes to the amount of amniotic fluid. Therefore, measuring a normal amount of fluid today cannot rule out the presence of bilateral renal agenesis. The study of the remaining fetal anatomy, on the other hand, appears to be normal, including the examination of the bony segments of the upper limbs, and all fetal biometric measurements are consistently in line with the gestational age. Given the specific findings presented in this case, and considering the association of Amelia's suspected sacral agenesis, a single umbilical artery, and the non-visualization of the kidneys and bladder, One of the primary diagnostic hypotheses that we can reasonably propose is Vater association, ERKE. Although this is classically a clinical and postnatal diagnosis, we are faced with the presence of at least three of the required criteria, as shown in this table. The other diagnostic hypotheses we can propose are caudal regression syndrome due to the lack of visualization of the terminal portion of the spine and the bladder, an infectious hypothesis due to varicella zoster virus, which can cause hypoplasia or amelia of the limbs, and a vascular insult resulting from an alteration in blood flow that occurred during the early stages of morphogenesis, which affected the development of the lower poles. The couple is advised to undergo genetic counseling and to perform on the product of conception all the tests that the geneticist deems most appropriate. Thank you all for your attention.